To Ghana now, where the government is yet to respond to our investigation, which uncovered evidence of abuses at a mental hospital in the capital, Accra. Focus on Africa found patients behind bars, going without food and being subjected to degrading physical treatment. Our crew saw off camera a patient having his groin shaved. Human Rights Watch described the conditions in Ghana's mental health institutions as filthy and says the government has done little to combat the issue. Here is a reminder of what our correspondent Akwesi Sapong found.
While inside, I met someone I knew before. He had been brought here some 3 weeks ago, abandoned by his family because he had been taking drugs and causing trouble. He won't talk to us on camera, but he begged us to get him some food. We also went by one of the male wards where one of the nurses on duty said that particular ward provided for 90 patients with only 2 members of staff of nurses available to care.
Now, the social stigma surrounding mental health in Ghana is not isolated, and many other countries across the continent deal with mental health issues in a similar way. In a moment, we'll hear about the situation in Zambia, but first to our reporter Pumza Fulani in South Africa.
Mental disorders are a big taboo in South Africa, particularly in African culture, where many believe that those with the condition have been bewitched. South Africa has one of the most progressive legislation on mental health, and yet the institutions that are supposed to care for them are often in disarray. Public mental health hospitals are plagued with reports of abuse, overcrowding and neglect. The few that can afford to use private facilities such as this one behind me. The infrastructure is better, medication is often in good supply, and there are enough nurses to care for the patients. They are the lucky few. About 80% of South Africa's 50 million people are dependent on public health care. And with a stretched budget, officials say there's often very little money left to allocate to mental health. Many who live below the poverty line are forced onto the street with no hope of care or rehabilitation. They are failed by the health system, rejected by their communities, and ridiculed by the families they love.
Here in Zambia, there are a few hospitals where mentally ill patients are taken for treatment. The main one is in the capital, Lusaka, and among those facilities is a center where those who are mentally ill but are in prison are also taken. Now, how do Zambians treat their mentally ill? Generally, they seek medical help and they're taken to these particular health institutions. But others also treat mental illness as a spiritual problem. So they either take them to traditional healers or to church. And how do ordinary Zambians react to those who are mentally ill and are sometimes roaming the streets? Well, there are some Zambians who give them alms and treat them with care, sometimes give them food. But then there are also those who look down upon them, treat them as outcasts, and fear them in certain cases.
Well, I'm now joined by Dr. Mary De Silva, Deputy Director of the Center for Global Mental Health at the London School of Hygiene and Tropical Medicine. Thanks for joining us on Focus on Africa. Now, we've looked at Ghana, we've looked at South Africa and Zambia. I mean, from your knowledge of mental health care in Africa, is that the same case across all countries, across the board?
I'm afraid it is. It's a very common picture, and people with mental health problems are subject to gross human rights abuses in many parts, not just in hospitals, but also at the hands of traditional healers and in the community, sometimes at the hands of their own family.
We've had a lot of questions coming from our viewers, some of them telling us the mentally ill are never really talked about, especially one here called Onyait Odeke in Uganda. And then we had Clifford Ichuku in Nigeria, who said the issue of mental health care is almost non-existent. The ill patient is let loose, the market or streets become their home. This is after exhausting the round of witch doctors and traditional leaders. Does culture or African religious practices hinder mental health care on the continent?
I think the focus really should be on providing an alternative biomedical model of care so that people can choose and have the option to perhaps follow both. The reason why mental health is such a hidden and stigmatised condition is because there simply are not the services available. So the people that we've seen in the hospitals in your reports are the tip of the iceberg. They are the few people who are able to access some form of care. But actually in countries such as Ghana, up to 90% of people with severe mental health problems receive absolutely no treatment at all.
But there must, of course, be some countries that take mental health care seriously. Are there no good news stories at all anywhere across the continent?
South Africa has a more developed health system and therefore better resources in general. And there are some isolated good news stories where, for example, NGOs are working. There's a CBM in Nigeria has a fantastic program treating people with schizophrenia in the community. The psychiatric nurse visits them in their home, provides medication and counselling and family support, and the person remains integrated into the community. And it's those kind of approaches which we need the resources in order to scale up so that many more people have access to that kind of evidence-based treatment.
Is there a historical link to all these that happens on the continent, do you think?
Yes, these hospitals were set up in colonial times, and whereas in the West we've been fortunate enough to have the resources to reform these hospitals, that hasn't been the case in developing countries. And what we really need is the political willpower and the financial investment in order to reform these hospitals, which after all perform an essential function for people in acute distress who have nowhere else to turn. So we mustn't talk about shutting these hospitals. We must talk about reforming them, giving them the adequate resources in order to be able to feed, clothe and treat the people which they desperately want to care for.
Well, we'll have to leave it there. Dr. Mary De Silva, a lecturer in global mental health at the London School of Hygiene. Thank you for joining us on Focus on Africa. This is Focus on Africa from the BBC. I'm Sophie Ikenye.